Avoid garlic if you have these 4 health problems. Garlic is a staple in many kitchens around the world. It is celebrated not only for its bold flavor but also for its numerous health benefits. However, despite its wide array of positive effects, garlic is not suitable for everyone. Certain health conditions may be exacerbated by the consumption of garlic. It happens primarily due to its specific chemical components, such as allicin, diallyl disulfide, and sulfurous compounds. These are the same compounds that bring the most benefits to garlic. However, in certain health conditions, they may make the issues worse. In this video, we'll explore 4 common health issues when people should avoid garlic. Understanding these drawbacks allows us to make better choices when adding garlic to our diets. Thus, we ensure that we get the most benefit from this spice. When people should avoid garlic. 1. Gastroesophageal reflux disease or GERD. Allicin, which is released when garlic is chopped or crushed, has a complex effect on the body. While beneficial for its antimicrobial and anti-inflammatory properties, allicin may irritate the gastrointestinal tract. For someone with GERD, this irritation may exacerbate the symptoms of acid reflux. When the irritated esophageal lining comes into contact with stomach acids, it may lead to an intense burning sensation commonly known as heartburn. It is frequently reported by GERD sufferers after consuming garlic. Apart from that, the influence of garlic on the lower esophageal sphincter, a muscle that acts as a valve between the esophagus and stomach, is significant. Normally, the muscle closes as soon as food passes through it, but certain substances, including allicin, may cause this muscle to relax. This relaxation of the lower esophageal sphincter makes it easier for stomach acid to escape back into the esophagus, a phenomenon that should be avoided in GERD management. By weakening the closure of the muscle, garlic may increase the risk of acid reflux, making it a problematic food choice for those managing this condition. 2. Irritable bowel syndrome (IBS). Fructans found in garlic are a type of fermentable oligosaccharide. They are particularly troublesome for those with IBS. They are part of a group of substances called FODMAPs, which are known to be difficult for some people to digest. When fructans are consumed, they aren't absorbed in the small intestine. Instead, they proceed to the large intestine, where they are fermented by bacteria, producing gas as a byproduct. This gas may lead to increased bloating, pain, and an uncomfortable feeling of distension, which are common symptoms for IBS sufferers. Additionally, the insoluble fibers in garlic may exacerbate symptoms of IBS. While fiber is generally beneficial for digestive health, it may be a double-edged sword for those with IBS. Insoluble fibers do not dissolve in water, and they may add bulk to the stool of people without digestive issues. However, for those with IBS, these fibers may speed up the passage of food through the intestines too quickly, leading to diarrhea, or they may irritate the intestinal walls, leading to further flare-ups of IBS symptoms. Enjoying our extensive knowledge about garlic? Don't forget to hit the subscribe button and ring the bell icon for more health secrets and tips. 3. Bleeding disorders. Allicin, the same compound that gives garlic its distinctive aroma and flavor, also plays a significant role in its anticoagulant properties. When garlic is crushed or chopped, it releases allicin, which may interfere with the clotting process. For individuals without bleeding disorders, this may be beneficial, reducing the risk of blood clots that might lead to heart attacks or strokes. However, for those with conditions like hemophilia or other clotting disorders, this effect may dangerously prolong bleeding times, making even minor cuts or bruises potentially serious. Garlic's ability to inhibit platelet aggregation is another factor that may be problematic for individuals with bleeding disorders. Platelets are small blood cells that play a crucial role in blood clotting. They clump together to form clots that stop bleeding. Garlic has been shown to inhibit the aggregation of platelets, thereby reducing their ability to form clots quickly. This effect, while often a preventative measure against certain types of heart disease in healthy individuals, may pose a significant risk for those who already have difficulties with blood clotting. 4. Low blood pressure. Polysulfides in garlic play a crucial role in blood pressure regulation. These organic compounds help to relax blood vessels, thereby reducing the pressure required to pump blood through them. For most people, this may be beneficial, especially for those managing high blood pressure. However, for individuals with already low blood pressure, this further relaxation of blood vessels may lead to a critical drop in blood pressure levels. This drop might manifest as symptoms like dizziness, weakness, or even fainting, which occur because the brain is not receiving enough blood and, consequently, not enough oxygen. Moreover, garlic stimulates the production of nitric oxide in the body, a natural compound that aids in the dilation of blood vessels. While dilation is generally a positive effect as it promotes better blood flow and reduces strain on the heart, in the context of low blood pressure, it may exacerbate the condition by causing too great a decrease in blood pressure. This is particularly risky in situations where blood pressure needs to be stable to prevent adverse symptoms. Now that we have discussed the problems of eating garlic for certain individuals, let's dive into the amazing health benefits of garlic. 1. Boosts the immune system. Allicin is perhaps the most critical compound in garlic when it comes to boosting the immune system. Allicin is known for its powerful antimicrobial properties. It may fight a wide array of bacteria, viruses, and fungi. This broad-spectrum antimicrobial helps the body fend off and fight infections more effectively. Additionally, allicin promotes the activity of white blood cells in the body, which play a crucial role in defending against pathogens. By stimulating these cells, garlic helps the immune system react more swiftly and effectively to invading organisms. Zinc, another vital nutrient found in garlic, is essential for immune system function. Zinc affects multiple aspects of the immune system, from the barrier of the skin to gene regulation within lymphocytes, the white blood cells that are integral to the immune response. Zinc is necessary for the development and function of many immune processes. It plays a critical role in the function of neutrophils and natural killer cells, and it supports the normal growth and function of immune cells. One study gave 146 healthy volunteers either garlic supplements or a placebo for 3 months. The garlic group had a 63% lower risk of getting a cold. However, there was no significant difference between groups in the time it took to recover from a cold. 2. Bone health. Garlic may enhance the body's ability to absorb calcium, which is crucial for maintaining strong bones. The sulfur compounds in garlic, particularly those derived from allicin, are thought to contribute to this effect. Sulfur is necessary for the formation of collagen and other substances that make up bones and connective tissues. Garlic increases the expression of genes involved in calcium absorption, making dietary calcium more available to bones. This is especially beneficial as we age, when bones naturally become thinner and lose density. Along with that, garlic has been shown to help reduce bone loss, particularly in women during menopause. Garlic's ability to minimize bone loss is linked to its concentration of beneficial compounds like diallyl disulfide. This compound influences estrogenic activity, which is particularly relevant for postmenopausal women who experience decreased estrogen levels, leading to increased bone resorption. By mimicking some of the effects of estrogen, garlic may help maintain bone density and reduce the rate of bone loss, offering a natural option for bone health maintenance. Finally, the anti-inflammatory and antioxidant properties of garlic also play a critical role in protecting against bone degradation. Chronic inflammation may lead to severe bone density reduction, a hallmark of conditions like osteoporosis. By reducing inflammation and the accumulation of oxidative damage in bone tissue, garlic helps preserve bone health and overall strength. In a 12-week study with 80 post-menopausal women who were overweight or obese, researchers found that the women who took 1,000 milligrams of garlic daily ended up having less pain compared to the placebo group. This suggests that garlic might help reduce pain in people with mild to moderate knee osteoarthritis. 3. Heart health. Garlic is widely recognized for its cardiovascular benefits. Garlic's influence on cholesterol levels is well documented. It contains compounds such as allicin, which are thought to help lower total and LDL cholesterol levels. LDL cholesterol is often referred to as bad cholesterol because high levels may lead to plaque buildup in the arteries, increasing the risk of heart disease and stroke. Garlic acts by inhibiting the synthesis of cholesterol by the liver. This reduction may significantly decrease the likelihood of developing heart-related conditions. Earlier, we told you that garlic has a notable effect on blood pressure, which is another critical factor in maintaining heart health. Red blood cells transform the polysulfides in garlic into hydrogen sulfide, which helps to relax blood vessels and lower blood pressure. For individuals with high blood pressure or hypertension, regular intake of garlic may lead to improvements comparable to some prescription medications. Additionally, garlic's ability to inhibit platelet aggregation also contributes to its cardiovascular benefits. Platelets are small blood cells that clump together to form clots when you have a bleeding injury. While this is crucial for stopping bleeding, excessive platelet aggregation may lead to the formation of blood clots inside the arteries, which may cause heart attacks and strokes. Garlic may reduce the stickiness of platelets, thereby helping to prevent the formation of dangerous clots and enhancing its protective role against thrombosis and similar cardiovascular issues. About 1/3 of 46 human studies showed a significant 11 to 26% reduction in bad cholesterol levels in hyperlipidemic patients after taking garlic powder for 4 to 16 weeks. 4. Detoxification. The sulfur compounds in garlic, such as allicin and diallyl sulfide, play a significant role in its detoxification benefits. The body produces glutathione, a potent antioxidant that is crucial for detoxification, and sulfur is necessary for its synthesis. Glutathione may help to neutralize and eliminate toxins by making them water-soluble, enabling their excretion via urine. The sulfur compounds in garlic may boost the production of glutathione, thereby enhancing the body's ability to rid itself of toxins, heavy metals, and other harmful substances. Additionally, garlic is packed with natural antioxidants like vitamin C and selenium, which protect the body against oxidative stress. Oxidative stress occurs when there's an imbalance between free radicals, unstable molecules that may damage cells, and antioxidants in the body. This stress is a common pathway through which toxins and environmental pollutants cause damage to cells and tissues. By neutralizing free radicals, the antioxidants in garlic prevent and repair cellular damage and support overall detox processes within the body. Furthermore, garlic has a positive effect on liver function, which is vital for detoxification. The liver filters and removes toxins from the blood, processes drugs, and breaks down alcohol and environmental contaminants. Garlic may enhance these liver functions due to its enzyme activation properties. Compounds in garlic may stimulate liver enzymes that help filter out and eliminate toxins from the body. This not only supports liver health but also boosts the overall efficacy of the body's detoxification pathways. In a study with 117 workers from a car battery factory, researchers found that those workers who took garlic saw significant improvements in several symptoms like irritability, headaches, reflexes, and blood pressure, with no significant side effects, suggesting garlic's detoxifying property. 5. Blood sugar management. Its positive impact on blood sugar may be attributed to its ability to enhance insulin sensitivity. Insulin is the hormone responsible for transporting sugar from the blood into the cells, where it's used for energy. When cells become more sensitive to insulin, it means that insulin may perform its job more effectively, lowering blood glucose levels more efficiently. Allicin may help reduce insulin resistance, a common issue in conditions like type 2 diabetes, by allowing the body to respond better to its own insulin and manage blood sugar levels more effectively. Moreover, garlic has been found to stimulate the secretion of insulin from the pancreas. This is particularly important because sufficient insulin production is key to managing blood sugar levels. By promoting more insulin release, garlic may help the body naturally lower high blood sugar levels. Garlic's sulfur-containing compounds are most likely responsible for this action, which may influence the pancreatic tissue to promote this increased production. According to 9 studies with about 770 diabetic patients, participants consumed 5 to 150 milligrams of allicin through garlic daily. The results showed that garlic significantly reduced fasting blood glucose levels. Now that you know how amazing garlic's health benefits are when consumed in moderation, you must be thinking hard about adding it to your daily diet. But how should you consume it? We brought you a fun recipe for that. A classic homemade garlic bread offers a perfect combination of crispy edges and a soft, buttery center. This recipe will guide you through creating garlic bread with fresh ingredients for a delicious result that's ideal as a side dish or appetizer. Ingredients that you may need: 1 loaf of French bread or baguette, ½ cup of unsalted butter, softened, 4 cloves of garlic, finely minced, 2 tablespoons of fresh parsley, finely chopped, 1 teaspoon of dried oregano optional, ½ cup of grated Parmesan cheese, salt to taste, 2 tablespoons of olive oil, optional for a richer taste. Now, follow these instructions step by step. Preheat the oven. Preheat your oven to 400 degrees Fahrenheit, 200 degrees Celsius. This high temperature is crucial for achieving that perfect golden brown crust. Prepare the garlic butter mixture in a small bowl. Combine the softened butter, minced garlic, chopped parsley, and dried oregano. Mix these together until you have a well-blended garlic butter. If you prefer a saltier taste, you may add a pinch of salt to the mixture. Slice the bread, cut the French bread or baguette in half lengthwise. Then, if you prefer individual servings, you may cut each half into smaller segments now or after baking. Apply the garlic butter, spread the garlic butter mixture generously over the cut sides of the bread. Be sure to spread it evenly, reaching the edges to maximize flavor in every bite. Add olive oil and Parmesan for an extra touch of richness and flavor. Drizzle a little olive oil over the buttered bread. Then, sprinkle the grated Parmesan cheese evenly over the top. This will add a nice, cheesy crust once baked. Bake the garlic bread. Place the buttered bread halves on a baking sheet, cut side up. Bake in the preheated oven for about 10 to 12 minutes, or until the edges are golden and the butter is bubbly. Broil for crispiness. If you like your garlic bread extra crispy, switch your oven to broil for the last 1 to 2 minutes of baking. Keep a close eye on it to ensure it doesn't burn. Serving once done, remove the bread from the oven. If you haven't already sliced the halves into smaller pieces, do so now. Serve warm for the best flavor and texture. Additional tips. Choosing bread for the best results, use a fresh loaf of French bread or baguette that has a good crust and soft interior. Garlic variation. If raw garlic's intensity is too much, you may saute the minced garlic in a tablespoon of butter before mixing it with the rest of the butter. This mellows the garlic flavor a bit. Cheese options. While Parmesan is traditional, feel free to experiment with other cheeses, such as mozzarella for a stretchy texture or a blend of Italian cheeses for more complexity. Garlic is undeniably beneficial for most, but it is not universally compatible with everyone's health. If you have any of the conditions listed above, consider speaking to a healthcare professional about your diet and the potential need to avoid garlic. Always tailor your diet to your specific health needs, as this may significantly improve your quality of life. In this amazing video, we learned about the potential downsides and benefits of garlic. Do you want to know more about some health secrets? Watch 12 things you should never do while taking apple cider vinegar. Or watch what happens to your body when you stop smoking after 30 days. Watch one, or even better, watch both. Do you prefer garlic? Let us know in the comments below.